Yeah, it's hard not to wade into the politics of this, isn't it, from any standpoint.
I said not too far.
All right. Well, as a hat in the insurance industry, I worked on Capitol Hill for a few years, and it was interesting to see how the laws are made, and then attorneys like Jason have to figure out how to advise people on how to comply. But it is the law, as Paul said, and I will tell you that are we living within it? Yeah, we are. There's been immediate changes. You employers know this. Some of the more immediate ones that you might remember just from within the last year or so. One I'll speak to because I think a lot of laws that are passed lead to unintended consequences, right? And one thing I'll mention immediately, our firm works both on employee benefit plans for employers, also some individual coverage, the individual health insurance market, which was also greatly affected by this. One of which was, if you remember, was that children would no longer be allowed to pre-X on children. Sounds good, politically sounds great. Everybody wants their kid to have access to care and not have a condition excluded. But the problem is someone has to pay for that care, right? There's premiums to be paid, but the insurers have to pay for that care. What happened in most states, in several states, Mel may know, but more than I from a national level, but is that a lot of carriers stopped offering child-only policies. Not because they don't like children, not because they don't have children themselves, but when you say, hey, you must insure this person, you can't assess the risk, you can't pre-X the condition, and the byproduct of that, unfortunately, was in many states, South Carolina, where my firm does a lot of business as well, even the largest carriers there stopped offering child-only policies, and still don't. As of October last fall, there's no such thing as a child-only policy. And there were thousands of those policies written every month. So this legislation, while perhaps well-intended in part, and there were some good things in this legislation. I just want to say that. There are, I think, some good things that came out of ACA or PPACA. But I mentioned that one just as some unintended consequences, which maybe didn't reduce access to care. I don't think our problem in this country is access to care. It is for a very small percentage, but it's the affordability, and I don't think this law did much to address that. The cost of care is expensive, you all know that. Therefore, the cost of insurance is expensive. It's a byproduct of the cost of care. The agents we work with, good agencies like JBA and others that are delivering health insurance renewals, and everybody's angry because it's a big dollar number and it's an emotional thing, people's health care. Everything's a byproduct of the cost of care. As Americans, we consume a lot of health care. And we do have a great healthcare delivery system. Novant's an outstanding hospital. My wife and my son were both born at Presbyterian Hospital in Charlotte, a Novant-owned facility. Great facility, but it is expensive to deliver the quality of care we have here. So there's no easy answer. I don't know, I'm probably out of time. I tend to ramble at times, but we are working within it. I do think changes need to be made, and maybe I can address a few of those that I think later in the discussion. So.
Ted, please.